My name is Elyse Wild, and you are listening to women's lifestyle magazine, Inspired Voices. Hi, welcome to another episode of Inspired Voices. I hope you are doing well. I hope you and your loved ones are healthy and safe, and I hope that you have a fulfilling weekend ahead of you. On today's episode, we're going to be discussing a really important topic that's occurring within the coronavirus pandemic. And that is that 40% of coronavirus deaths in Michigan are occurring in Black populations. And the Black population makes up just 14% of Michigan's total population. Raven Odom of the Grand Rapids African American Health Institute joins me to discuss this startling and sobering data that is evident of the deep inequities that have persisted in our communities for a very long time, and what we can do as a community to better support outcomes for everyone. I hope you enjoy my conversation with Raven. I hope that you learn a lot. I hope if you feel like this topic isn't for you, that you listen anyways and that it changes your mind. This is something that concerns all of us. We live in a really wonderful, philanthropic, giving community, but there are parts of our community that are really left out from all of those positives. So I hope this conversation sheds some light on that for you and prompts you to take action and to help where you can with this situation right now. All right, here we go. Thank you for listening. Okay, today I'm joined by Raven Odom. Raven is a health advocacy administrative fellow of the Grand Rapids African American Health Institute. And we're going to be discussing a difficult and important topic, inequities in coronavirus mortality. Raven, thanks for joining me today. Before we get into our topic, can you tell us what the Grand Rapids African American Health Institute does? It's also known as GRAHI, and why it's so essential to the overall health of our community.
Yeah. Well, thank you, Elyse, for having me today, and thank you for thinking of GRAHI. GRAHI was founded in 2002, so about 18 years ago, in response to prevalent inequities in the Kent County area. So noticing that African Americans experience vast differences in health and health outcomes. So a need to address those health outcomes and ensure that African Americans received access and the support that they needed for their health and well-being. Our mission overall is to promote health equity in the Grand Rapids African American community, and we do that through education, advocacy, and research. And we operate on two different levels, so a programmatic level and a systems level. On a programmatic level, we offer health promotion and health education programs, such as our Diabetes Empowerment Network and our Real Women, Real Change program. We also have a Strong Fathers program where our fatherhood team works with fathers of young children to provide them with the resources and support they might need. And then thinking on a systems level, we do that through our advocacy work, so pushing forth policy calls to action to advocate for change in systems, our pathways to healthcare careers, where we're looking to increase the number of Black and Latinx healthcare providers.
That's great.
And then we also have our health equity index, which provides data to our partners to really highlight the health and racial inequities that we see.
Wow,
And
that's really comprehensive.
Yeah, and you asked why this is essential or important to the overall health of the community. Is because these inequities persist. So we need programs that are targeted to address these inequities and ensure that, again, that African Americans have the support and the resources necessary. And not just that they have the support, but that systems are adequately and appropriately supporting them.
So the numbers regarding inequities in the coronavirus mortality rate in the state of Michigan, they're sobering, to say the least. 14% of Michigan's population is African American, yet African Americans make up 40% of coronavirus deaths. This isn't unique to Michigan. Similar numbers are emerging all over the country. And now we know that viruses don't discriminate, but that systems do. Can you shed some light on these numbers and how we got here, how we got to a place where we get that 40%?
Yeah, I think you touched on it right there. Systems and systemic racism that's been prevalent in this country for years and years. The racist policies and practices that have, quite frankly, impacted our health and well-being, our economic well-being, and many other factors. So if we think about redlining and housing discrimination, that's impacted folks' ability to build wealth. It's a fact that Black people are more likely to live in an area with a pollutant facility. So the impact of concentrated air pollution, food deserts and your, inability to have access to fresh fruits and vegetables right in your neighborhood or in the area close by. We think about job discrimination and income inequality. So maybe doing the same job as someone else, but because of my race or ethnicity, I'm paid a lower wage. And so how then does that impact my ability to care for myself, care for my family, and purchase essential goods? So maybe I have to decide then, do I purchase my prescription medication, or do I pay for food, or do I pay for utilities, water or heat, these things that are essential in our day-to-day lives. Mm-hmm. Another one I want to highlight is mistreatment within healthcare systems. So provider bias is a real thing. And not only provider bias, but, the fact that African Americans and Black people are more likely to be uninsured. So not being able to access these essential services that we need. We think about the prison industrial complex and housing insecurity, like so many things. And also I want to, in this moment, highlight the fact that many Black community members are more likely to be essential workers. So in this moment, the protectors that, take these precautions to stay safe, some of us aren't even afforded that opportunity. But not only the systemic inequities have created this present moment, but also the failures of government in this moment to step up and provide the needed support.
Mm-hmm. Mm-hmm. Oh, for sure. I'm glad that you brought up the fact that a lot of the Black population are essential workers. And also, as far as access to work that provides a livable wage, and the lack of choices in your healthcare that comes from that. Like there's a lot of people are really fortunate to have health insurance provided by their employer, and there's a huge difference in that care. Not to say that our community resources surrounding healthcare, like Baxter Clinic, is wonderful. Cherry Health is a great place, but there's a difference in care when you get to choose your doctor through insurance policy. What I'm hearing you say is that it's all these structures that are a part of so many different parts of our lives that we don't necessarily associate immediately with health.
Right.
It's not like literally just the healthcare system. It's all the systems.
Yeah. When you look at the social determinants of health, so it lays out different systems. All of these, they influence one another. And then, you imagine that joint impact. So it's not just my inability to access fresh fruits and vegetables, but then pair that with I don't make a livable wage, so it's hard for me to then purchase prescription medications, or the neighborhood I live in, I don't have access to parks or green spaces where I can go out and enjoy the fresh air and even exercise, or so it's, when you think about the confounding impact, it's hard to wrap your head around.
It is, yeah. And Grand Rapids is a wonderful city. We've come a long way. We've enjoyed all this amazing development over the past 10 years. I grew up here, so I've been able to witness that. But unless you think about it, and it's considered how our most disadvantaged populations, what their experience of the community is like, it really kind of takes away a lot of that progress, because if things are great for people for whom it's always been pretty great, then what kind of accomplishment is that? So on that, on community, what can we do as a community to have a positive impact on these inequities in this moment, and then also moving forward?
Yeah, I feel like there are a bunch of things, but I'll try to keep it brief. So first, I just want to say, don't let this be just a moment. Oh, okay, because it's in the headlines or the inequities are being talked about, don't let that end once the COVID pandemic is over. The conversation and the action to address health inequities or racial inequities, that needs to continue well beyond the pandemic. So I would say to everyone, maintain that commitment, not just during COVID-19. Use your platforms and your sphere of influence to amplify the work of organizations and people who are pushing for equity and calling for system change. On a personal level, I think, it's called for us to examine, how you vote, how you spend your dollar. We've seen who's getting support with the bailout, that's intended for some of the small businesses, maybe some of the larger companies have taking advantage of that. If you're able to, I would say donate to mutual aid funds. We know that everyone has not been able to benefit from the support that the federal government has rolled out. So folks who are undocumented, or there may be other circumstances that prevented folks from, or that, that were reasons why folks weren't included in the benefit, included to receive the benefits. And then when we think about health systems, advocate for free testing, the continuation of data collection disaggregated by race and ethnicity and SES. Employers, providing PPE for your employees, especially those who, like we said, are essential workers. Pay medical leave for employees. And don't be silent. Acknowledge and call out the failures of the federal government, call out the failures at a local level, at a state level. Continue to, raise your voice. And I would say also examine the policies and practices at your organizations and companies. Do they provide health insurance coverage? Is there income inequality? Things like that. And on a broader scale, thinking about some of the systemic inequities that we talked about before, pushing for safe and affordable housing, eliminating income inequality, pushing for a living wage. I saw a tweet from a cashier that said, please stop calling me a hero and instead call your representative and tell them we need $20 an hour. Wow. Advocating for universal internet access. Like I said, just in your sphere of your work, in your sphere of influence, amplify the voices of those who are impacted, and let this be a reminder that some of the things folks said weren't possible. Oh no, we can't do that. We're seeing that it actually is possible when we talk about internet access, when we talk about freeing folks from jails and prisons. And lastly, I would say, there's an article in the New Yorker by Kinyanga Yamada Taylor called The Black Plague. I would encourage folks to read that. And I would just end by asking folks to put their energy towards building a new system.
That's great. We will, that was very well said. We'll link to that article below this video so that people can access this right away.
Okay.
Awesome. That was very well said, Raven. I really appreciate your insight. Something that I want to bring up too, and that, I've learned as someone who is white and I'm not part of a minority community, I don't necessarily have a lot of barriers as I navigate the world. The book, A City Within a City, is so illuminating. And it really shows that, a lot of times when we talk about these inequities, there can be this underlying narrative of like, oh, well, civil rights is past, all these, we don't live in that world anymore.
Right.
And I think that really can put like the kibosh on these conversations that are constructive. But so much of what people experience today are from systems that were put in place like 100 years ago or 50 years ago, and they still have an impact today. So that, and all that, those particular systems are outlined in A City Within a City, which is specifically about Grand Rapids. So I'll link that below too. It's a great read right now. So the things that we do today to rectify these inequities not only impact people in their experience today, it will impact people 50 years from now, 100 years from now. And it's so important. The scale of the importance of it I cannot emphasize enough, and how much of an impact these seemingly benign systems have on people's lives today and tomorrow.
Exactly. Yeah, the systems have all the impact. So, I think the City Within a City book is a great resource for folks to read as well.
Raven, thank you so much for joining us. Is there anything else that you'd like to say about what's going on right now, or about your hopes for the future?
No, I will say that I am hopeful. But like I said, it takes a commitment on our behalf to push for these things, and not just, because it sounds good, but to actually take the action to change the system. So I hope that folks will join in that effort.
Thanks for listening to my conversation with Raven. This is a really difficult topic to talk about and to address, but it's a reality, and as I said at the top of the show, it's something that concerns all of us. And I would encourage everyone to take Raven's advice and to not let this be a moment, that perhaps this can be an impetus for real and actual change in our community, although it's unfortunate that it will come at such a great expense to a vulnerable population. We will be staying in touch with Grahi throughout the duration of the pandemic to keep up on things they are doing to support the African American community during coronavirus. They have a few things rolling out in the future that we could all help with. So as soon as they start rolling that out, we will bring it to your attention. Below this video is a link to the New Yorker article that Raven mentioned, and also a link to purchase A City Within a City through Schuler Brooks, which is a local bookstore. If you haven't heard of them already, they are such a great store, one of my very favorites in town, and they are doing curbside pickup right now, so you can still purchase their products. And if you're curious about the book, if you want to learn more about systemic inequities in our community, I encourage you to buy it and support a local business. To stay in touch with us, please visit www.womenslifestyle.com and sign up for our newsletter. You can also listen to this podcast on YouTube. Our YouTube channel is Women's Lifestyle, all one word. If you have any ideas for a podcast episode, or if you'd like to hear from someone we haven't interviewed yet, please reach out to me at elyse@womenslifestyle.com. That's Elyse at womenslifestyle.com. I hope you are all staying healthy and staying safe, and thank you so much for listening.